Jill Moloney is a member of the St Anne's class of 1983 and has had an extensive career in nursing and public health in Australia and internationally. In 1984, Jill commenced her study of nursing at the Warrnambool Base Hospital and then began her first nursing job in Darwin. From there, she worked throughout the Northern Territory, Queensland and Melbourne in Victoria. After going to Sydney to study midwifery at the Northern Sydney Area Midwifery School, Jill returned to Alice Springs and went to Moloney in East Arnhem Land, where she developed an interest in public health. In central Queensland, Jill's interest in public health became a career, and she was soon looking after clients in a 540,000 square kilometre area. In 2000, Jill began her international work after applying to a newspaper advertisement for a midwife to work in Cambodia. Jill returned to Australia to complete a Masters of International Public Health at the University of Sydney. Jill's next role was in North Korea, a country that is usually closed to foreigners. In North Korea, Jill developed and introduced a successful program designed to improve birthing services. At the time, the North Koreans were using outdated 1950s styles obstetric techniques. A role with Save the Children in Pyongyang, North Korea followed. Working with the Korean Maternal and Child Health and Family Planning Association, Jill was asked to replicate the program she had introduced. The program was put in service for the entire country for doctors, their assistants, midwives and nurses. During a stint in Niger during the drought and famine emergency, Jill worked in community mobilisation where she developed a system of food distribution. Working in public health in Uganda, Jill returned to a maternal child health focus, teaching traditional birth attendants through a hospital midwifery school established by the Vatican. Jill adapted and implemented the curriculum she had developed for North Korea. There was civil war at the time, and when cholera began to spread in refugee camps, Jill became involved in the anti-cholera response. Jill's work then took her to Timor-Leste and the Solomon Islands, followed by a return to Cambodia, supporting the University of Health Science as an advisor, working with preceptors in the midwifery programs of various hospitals. In Laos, Jill conducted a nutrition survey and was the mentor for the head of a hospital midwifery department working in education management. In Laos, Jill also bred chickens to give to women's groups to assist women to earn an income. After working in primary healthcare in Burma, Jill again returned to Laos to work in public health. After a return to the Northern Territory, Jill worked on the Australian Nurse Family Partnership Program. The top-end program is the first site in the world where the program is being implemented in remote communities. Based in Darwin, Jill serviced the community of Warrnambool on the community engagement aspect of establishing the service. Jill's work in public health has saved many lives around the world through improving birthing services and live birth outcomes. We welcome Jill Moloney to the Emmanuel College Inspiring Alumni.